I'm here to share my experience with a very commonly prescribed medication, generally for treating depression and anxiety, which is Escitalopram. Yeah, that's how we call it, and Escitalopram. I started taking it 1 day ago, so it's still quite early in the process. My suggestion generally about medication is that if you're having trouble going through the day, if you can't even get out of your bed in the morning, then maybe consider medication as an option so you can get to a minimal functional level so that you can go out in the world and seek the help that you need. So the doctor prescribed me with the 15 milligram escitalopram. I can show you, it looks like this. Each pill consists of 15 milligrams, and you can actually break one pill into two, so it would be 7.5 milligram a day if you want to take it that way. I take one pill every 2 days, so I was hoping that the side effects wouldn't get as aggressive and I can give my body more time to adjust to the medication. I took the initial pill with food the evening 1 day ago, and after a few hours I definitely felt dizzy and sort of was a bit high, and in the night I had quite bad muscle pains in my legs, but I suspected that had more to do with the walk I took on the day. The second day I spent in dizziness and I had no appetite. I was yawning so much. I don't think I ever yawned so much in my life. I was generally feeling quite tired. But that being said, I will continue sharing my experience after having taken the pills for a couple more days and see how things go. So it's been a couple of days since I started taking escitalopram. I forgot to mention in the previous clip that every time I took the pill, there would be a period of time in which I felt increasingly anxious and restless, and so the doctor gave me a shot of tranquilizer to help me counter this effect of temporarily increased anxiety. But the real story happened 2 days ago, when I was just taking my fourth pill. So remember how I was taking one pill every 2 days because I was being cautious, even though my doctor told me to take one pill per day. And after consulting the doctor, I started taking one pill per day. So what happened was, the day after I took the third pill, I took the fourth pill at around 2 p.m. So I had the normal side effects afterwards, and nothing particularly striking or anything. However, at around 9 p.m. I started feeling a very weird sensation in the middle of my brain and also down my spine. So how do I describe it? It's like your nerve is itchy and there are ants crawling on your spine. It's a very unpleasant feeling. I can't really describe it precisely, but I wouldn't wish it upon anyone. It's not a painful sensation, it's just very unpleasant. And I just wanted to bang my head against the wall, but nothing could stop it. And as time passed by, it got worse. And by 12 p.m. I was visibly shaking. And sometime later I realized that I could not move my neck properly. So what happened was it would just involuntarily move to one side like this, and I couldn't move it back. And it was really, it was a bit painful and really scary. So I was texting some of my friends. We all think it was an emergency situation that potentially had something to do with the fact that I was taking the pills. So I called my housemates and they called ER to come to help me. And when ER came, I had a small panic attack. So I had difficulty breathing, and the people who came to rescue me had to help me breathe with the mask that they brought. But it calmed down afterwards. So then I was taken to the hospital. My symptoms were probably at their worst when I was just taken to the hospital, and the doctors couldn't really help me. They just asked me a lot of questions, so I was almost puking every time I yawned, so I was still yawning and having a lot of weird sensations in my head. So the doctors thought at that time what I had was a panic attack, even though I already had a small panic attack. And because I have had many panic attacks in my life, I know the difference. So I personally don't think it was. And I just don't think the panic attack could happen for such a long period of time without a clear trigger, and it actually lasted for a day or so. And afterwards, I consulted a lot of different doctors at the hospital. They did all kinds of tests on me, and all the test results came out normal. So I didn't really have any disease, underlying causes to make me feel the way I felt. And a psychiatrist at the hospital said that it is possible that I had a rare reaction to escitalopram that I was taking. So what I think happened was that I was taking 15 milligram every 2 days, and then suddenly I increased it to 1 day, 1 pill per day. So like on that day when I took the fourth pill, there was an increase in the SSRI in my system, and so a dropped level of serotonin binding in my brain, and somehow it might have triggered maybe a mild version of serotonin syndrome or something of the sort. I'm not a doctor, I don't really know this kind of things, but I'm just really convinced that it had something to do with escitalopram. But if it's serotonin syndrome, then it usually happens when you take 2 SSRIs or more at the same time, and it usually happens with a high fever, so that's definitely not what I had. So I couldn't conclude what I had exactly. If anyone has any similar experience or know anything of the sort, then you're very welcome to contact me and we can have a chat. Like I said, I honestly wouldn't wish this upon anyone. What happened to me happened after I was strictly following what the doctor was telling me. So this just tells me that you really need to be careful about what you take into your body. I still think SSRIs are really helpful, especially if you have anxiety, depression, mental health issues. You just need to be careful and consult your doctor. If you have any uncomfortable symptoms, if you are having concerns or are afraid of taking the drug, you should always keep the communication open. Especially if you're just starting to take an SSRI, then what normally happens is you start with a lower dose, for example 5 or 10 milligrams of escitalopram, and you slowly build up. And also if you want to stop your medication after a while, then it's dangerous to suddenly stop. You usually taper off, like taking 10 milligrams for a while and then taking 5 and so on. So I think for me personally, I will discontinue escitalopram, or maybe I'll still be on it for a lower dose. After consulting my doctor, I will know. But I just personally have this fear about the drug. But I will definitely discuss it with my doctor. I just hope that all of you stay healthy and happy, and none of this situation that happened to me would happen to anyone, like really. Thank you.